get my little stopwatch going so I don't do anything crass. So, what does an economist for the Forest Service end up being in New Zealand studying public health? This is somewhat a convoluted story. Now, my primary research focus has been, well, for 10 or more years, is quantifying the benefits that urban trees provide. But I didn't start with public health. I'm a natural resource economist, so I started with things like the effect on energy use, on house prices, on stormwater. And then I started to get into more social benefits like crime reduction. But then I started to realize that really public health's where it's at. In terms of the benefits of the natural environment, yes, that would be a tough sell to this audience. It probably makes a lot of other benefits rounding error. So in terms of exposure. And also the paradox that people get the greatest benefit from the natural environment in urban areas. That's where they get exposed to that. So about 6 or 7 years ago, I started on the public health. So what I'm going to do is I'm going to describe a couple of studies I've done that take somewhat unusual approaches to this problem, and hopefully you may find them interesting. In the first one, I use the spread of an invasive tree pest as a natural experiment to see what happens if you kill a lot of trees in a short amount of time. Do you see an impact on public health? And in the second one, I used moss on trees to map air quality and actually identify some public health risks. But let's begin with the bugs. One of the real big headaches when you're doing sort of natural environment and health stuff is residual confounding. Now, I know it's not hardly unique to just this. In epidemiology, it's a problem with a lot of things. It's a real issue because, as you probably realize, where are the neighborhoods with the nicest trees? They're going to be whiter, wealthier, and better educated. And we certainly know race, education, income, important drivers of health. So that can be really difficult to untangle. Interestingly, in the US, the pattern's reverse rurally. So in rural areas, trees are a pretty good marker for poverty. What makes matters worse is also that trees grow at a tiresomely slow rate. This is something I've come to personally resent. It's a bit awkward if you're in forestry, but I have because what makes them very difficult to experimentally manipulate. Imagine a randomized controlled trial of the health benefits of trees. It would be expensive, long, you need millions of dollars and decades. Now, I would certainly do it, but people have not been happy to provide that. So what you're really stuck with mostly is doing cross-sectional studies, trying your best to control for confounders, and then trying to ignore that gnawing stomachache that never quite goes away. So I was worried about this about 5 years ago, and for probably the one and only time in my life, the anxiety actually paid off, and I realized that you can flip this question on its head. That is, if trees are good for you, then killing them should be bad for you. Right? I'm not getting that grand revelation look from you all, but it is actually, why is this what approximates a grand revelation for me? Because it opens up new methodological avenues, because trees die a lot quicker than they grow. So you have the opportunity to study longitudinal change without having to get bored to death waiting for the trees to grow. But obviously to do that, you would need a lot of trees to die in a short amount of time. Well, what could do that? Well, invasive pests do a sort of admirable job of killing a lot of trees. And in the US, in the last 10 to 15 years, the nastiest is the emerald ash borer. It kills ash trees, and it's killed hundreds of millions of trees since it was first detected in Detroit in 2002. It kills all untreated trees in about 2 to 5 years, and it kills all 22 species of North American ash. So to give you an idea of what it can do, this picture was taken in Toledo, Ohio in 2006, beautiful tree-lined street. This is the same street in 2009. So a virulent little beast, terrible for everybody else, magnificent for me because it gives me this opportunity. Also a very handsome little beast. Very small, and unfortunately has exit holes high in the tree, so you'll never get to see him. But as an aside, invasive tree pests are on the rise around the world. This comes from a Science article in 2013 showing the number of invasive pests in different parts of the world. Line A there is the US, see, rising steeply. C is Europe, and D is the UK, and it's good to see my homeland there catching up quickly. And certainly, and I mean, this paper, and when you hear about invasive pests, people talk in terms of the ecological problems they're going to cause, sometimes economic, depending on the species they'll affect. But I suspect strongly that the biggest threat they face is to public health, and that they really are potentially quite serious threats to public health. So how can we take advantage of this little bug? Well, I can put my hypothesis in very formal terms here. I'm going to show you some little pictures that give you an idea of the sophisticated inner workings of my mind. So here's my hypothesis. We have healthy little people because they've got trees. So EEB comes along, defoliates the tree goes, and then the person doesn't do it very well. I can take that through again if that was not too sophisticated, but that took me a while to come up with. So that's the sort of general hypothesis. Now, this is a natural experiment because we're not randomly deciding which trees die, obviously. The bug does that. But, and this is the really important thing, there's a wonderfully random element to the spread of EAB. So this little animation will show you how it spreads. This is from 2002 in Detroit, out, I think this one goes to 2013, to Boulder County, Colorado. And it'll cycle through again. You see the wave-like spread you would imagine. But you also see these satellite populations popping up hundreds of miles from the nearest infested county. So Boulder County there is hundreds of miles from, I think, the nearest county there would be like Kansas City, Missouri. And you also see there's a sort of big blob to the south there in Tennessee. The story there is apparently got ash is a popular firewood, so it gets moved around accidentally in firewood. Probably brought to Tennessee in people bring firewood to a NASCAR race. So it gets moved around. The first place you often see in a county are roadside rest areas. This is how it gets around. But when you look at this, can you imagine another driver of public health changing as quickly and following this sort of pattern? Can you imagine changes in race or education or income mirroring this? It's much more difficult to imagine that compared to the presence of trees at one point in time. So this is the real sort of methodological advantage of this. So what health outcomes did I look at? Well, I chose to look at cardiovascular disease and lower respiratory disease, which in the US are the first and third largest killers. And I did that because there are plausible mechanisms linking trees and those two causes of death. We certainly know that trees can improve air quality. We also know that if you put people in a natural environment, in an experimental setting, you're going to get short-term reductions in short-term markers of stress. Heart rate goes down, blood pressure goes down, salivary cortisol goes down. And we certainly know that air pollution and stress are major risk factors for cardiovascular and lower respiratory disease. So there is a plausible story going in linking trees and these two causes of death. And I chose to look here at county level mortality. County level, again, these were pragmatic choices. The little black squares here are counties, just of ease of access for the data. And I looked at mortality again because mortality data are cleaner than trying to look at just incidents. So, what I looked at is county level mortality from 1990 through 2007. So this long running period with no bug, you add it in 2002, and you see what happens, controlling for differences in the demographic makeup of these counties. What I found is that counties infested with EAB had higher rates of cardiovascular and lower respiratory disease. And the sort of size of this, both the significance and the magnitude of this effect increased as an infestation progressed. You're seeing the sort of dose-response relationship. More trees die, more people die, which is sort of encouraging methodologically, if not from a public health perspective. And we also saw an interesting thing, bigger health impact in wealthier counties. Why would that be? Well, because those wealthier counties are likely to have more trees, better maintained trees, they would provide greater health benefits. So you would anticipate then that there would be greater impact if you take them away, which is indeed what we found. And across, this was 15 states in 6 years, so an additional 15,000 deaths from cardiovascular disease and 6,000 from lower respiratory. So clearly 21,000 deaths, this is a non-trivial number. And when I got this initial result, I did what any good researcher with a delicate ego would do. I told nobody, I shut my door, and I tried to disprove my own results. I can tell from personal experience that private disappointment beats public humiliation. And I can speak with authority on that particular point. And so what I decided to do was look at a cause of death that could not plausibly be impacted by EAB. In this case, accidental death. Certainly, beetles are not causing car accidents. And there was found no relationship. Is that definitive? No, it's not like a control in an experimental setting, but it is encouraging that I found a relationship between EAB and 2 causes of death it could plausibly affect, and I didn't find one between EAB and a cause of death it could not plausibly affect. So that was encouraging. Now, this study is not without its difficulties. It's an ecological study. I was looking at county level mortality. This was a pragmatic choice. So once I got this, I thought, oh, right, I was kind of as surprised as anybody here. I need to go the extra effort and actually look at individual level health data. Because there's obviously the well-established problems with ecological studies. So I kept with a county level measure of exposure here. So it's kind of a semi-ecological study. And to do this, I used data from the Women's Health Initiative, which is a big cohort study in the US of postmenopausal women. So 161,000 women recruited in the mid-90s, 50 to 79 at recruitment. And I just cut to the bottom line here was that I found that a woman's risk of having a stroke, heart attack, or dying from cardiovascular disease was 25% higher in counties infested with EAB. And this is after controlling for a wide range, things, what type of things did we control for? Age, race, education, income, smoking status, BMI, exercise, emotional well-being, diabetes, hypertension, a whole host of things. Women's Health Initiative is very data rich. So this was encouraging. Again, is it definitive? Absolutely not. It's encouraging when you have the county level and the individual level studies point in the same direction. Now, since this first paper was published in 2013, several other studies have used the spread of the emerald ash borer to look at other health outcomes. For example, in 2015, there was a study found that EAB was associated with a reduced probability of engaging in outdoor recreation. So this comes from the paper. If you look at this, concentrate on this top panel. So the y-axis there would be the probability of engaging in outdoor recreation, and time on the x-axis. Here is when you have an EAB infestation. So before EAB infestation was not associated with the change. That may sound ridiculous, but it's encouraging that you don't see an effect before it arrives. These things can happen. And so you see here that the year after it arrived, you see a significant decrease in engaging in outdoor recreation, and that effect fades but persists and is still significant there after 5 years. And the same author also found the EAB was associated with reduced self-reported mental health. And one of the things I realized, so I've been kind of really obsessing about natural opportunities for natural experiments, is that yes, you could look at other things that have made major changes in the natural environment, but the natural environment doesn't necessarily have to change. You could also look at things like changes to access. When I was a kid, growing up in England, anybody could go on the school fields, walk their dog, do what they wanted. I don't know if officially they could, but that's what it happened. And then a few years ago, in a rare but ill-advised bout of nostalgia, I was back in England and I decided, I'm going to go visit my old school. And I got there and there's a fence. Well, I climbed over the fence and I got busted by a security guard and tossed out. So now you don't have any access. And this is a fairly built-up neighborhood. It's clearly the largest area of green space in the area. It would be interesting to see what happens when you do that. What happens when you prevent people getting access to these sort of areas of green space? And this research has got a fair bit of media attention, which can be, it could be a mixed blessing. For example, last month I got a call from Wired magazine because there's another little bug in Southern California called the polyphagous shothole borer, and it's going to cause significant tree mortality in Southern California over the next few years. And so he'd read my paper, he actually read it, which for a journalist is unheard of, and he wanted to know, okay, so say anything about the likely public health impacts in California. And he seemed like a smart guy, he's pretty nuanced, he was exclusively a science reporter, so I was pretty excited. Oh, he's going to do a pretty okay story. And a few weeks ago, he emails me the story, and I open it up and I look at the title and realize that there's probably not going to be a lot of nuance. This one. Yeah, I was like, all right. That's fantastic. That's fantastic. My wife laughed for 10 minutes. I thought at one point she wasn't going to be able to breathe. So there you go. But so now let's leave the bugs for a second and go to something completely different, which is tree moss, which I probably don't associate with public health a great deal. So what's the link between moss and public health? Well, several years ago, I was interested in looking at the impact of trees on air quality, because I'm trying to explore the mechanistic links between the natural environment and public health. We know that there are plausible ones, but we don't really know how important different ones are. And in Portland, we have really pretty good tree data. We have sub 1 meter resolution tree data. We have LiDAR data, so it's three-dimensional. So we can tell you where individual trees are in the city, what size they are. But our air quality data are hopeless. At the time of the study, there's one permanent monitor in the city. Now, this is pretty typical. We knew an alarmingly little about what's in our air. Major cities often just have one or two monitors. And for pollutants that don't actually disperse far from the source, it would be more honest to have none. So I couldn't, I was a bit stuck here. And I got chatting to a colleague of mine who's a lichenologist and bryologist who studies mosses and lichens. And for years, she'd used them to study forest health. So out in the woods, you can do a couple of things. You can look at the species diversity, but also you can take, as you'll see in a second, you take the tissue, grind it up, and test what's in it. Now, why would moss be a good bioindicator of air quality? Well, for a number of reasons. One, moss have no roots, so they get all their moisture from the air. So very good measures, bioindicators of air quality. They're going to get nothing from the soil. They're not even going to get anything from the tree they're on. So everything's going to come from the air. They're also cheap. Taking one of these samples and testing it for heavy metals, which is what I'm going to talk about, costs about $50, whereas operating one of these large EPA air quality monitors costs hundreds of thousands a year. That's not to buy, just to operate. So it's very cheap. And then the third, they're simple little plants, and they don't have a waxy epidermis. So both pollutants can diffuse pretty readily into the tissue, and they're also frondy, so they just stick to the outside. So they're pretty good at that. So where am I? Oh, so we decided to do this study in Portland. So from December the 2nd to December the 23rd, 2013, we collected 347 samples from across the city. So here I am on the rarest of rare things, which is a sunny day in December in the Northwest. And you'll see here the moss is pretty happy. Well, I should say, you'll see in this previous one, this was taken about 20 miles from the city. And you can tell it's good air quality because there's actually quite a lot of lichen on that tree. But lichens are hopeless. They die off really quickly with even modest air pollution. So, here's on the edge of the city, so the moss is doing fine. You can see there's a little bit of lichen. But you get into an area like this along a major road, the lichens have taken their bat and ball and gone home at this point. They're just not doing it. But this particular species of moss seems largely ambivalent to air pollution, doesn't care. It'll get a little black and stunty, but we could find it all over the city. So we collected these points, and what we'd done is we put a 1K grid across the city, put a random point in each one, and then we'd also put an additional 72 points within the 100 meters of these base points, because what we wanted to do was really characterize the spatial autocorrelation. And that, just from a technical point of view, is because we were estimating a model with the 347 points and then using that to predict on a 50-meter grid across the city. So we trained on 347 points and predicted on 173,000. And to do a good job of that, you need to understand the spatial autocorrelation. But that's technical nonsense. So what we did, we collected them in these metallicized bags. We kept them cool. We took them into the lab. So in the bottom panel, that's kind of how it came in, covered in dirt, little creatures in there, all sorts of strange things. So in the top panel, you'll see what we would do. We would just cut off most of the dead material, just clean things off. We wouldn't wash them because we didn't want to wash off pollutants from the outside. Then you'd end up with a sample, hopefully like that in the bottom right. Take about an hour and a half a sample to do that. So that was quite labor intensive. So we sent them off to the lab. And the first thing we decided to look at was cadmium. Why cadmium? Well, because it's a bit of a mystery in Portland. The state environmental regulator, which is the Department of Environmental Quality, is known since at least 2005 that there's too much cadmium in the city. What I mean by is they know where it should be coming from. They know the businesses that have permits to emit cadmium. They can estimate what that means for air quality at a particular point. But on the rare occasions when they can muster themselves to actually do that, there's too much cadmium. But they just kind of wrung their hands and didn't know what to do, so they hadn't been able to identify that. And cadmium, for those of you not familiar with it, it's very nasty, it's carcinogenic, neurotoxic, can also cause kidney disease. So it's clearly an issue from a public health perspective. So we decided to look at that. So this next thing is a map, and what this shows is our standardized values of cadmium. And you see this map is dominated by these two hotspots. Now this sort of pattern was not surprising, because cadmium is emitted from a limited number of industrial processes. It's not emitted from car exhaust or things like that. So you would expect a kind of bullseye pattern. So everything's good so far. And at this point, still the focus of the study was the effect of trees on air quality. So we thought, okay, in our modeling, we need to just account for those two big sources, and then we can move on to what we really care about. So what I've done on this map is shown you the 10 largest, see these sort of purple circles, are the 10 largest permitted emitters in the city. That is, and the size of the circle is proportional to the amount of cadmium they're allowed to emit. We were expecting those to be, a couple of those big purple circles to be right in the middle of the hotspots. But as you see, this is where they are, so nowhere near. So this is a bit confusing. So we go back to DEQ and say, well, we've got these two unexplained hotspots. What should we do? And they said, well, try looking at electroplating businesses and stained glass manufacturers. Now, cadmium electroplating is very specialized. It's used in the aerospace industry. And then cadmium is a pigment in glass manufacturing, like a lot of heavy metals. Anything that colors glass is nasty, basically. So we thought, okay, well, we'll go do that. So the first thing, there's actually only one business in Portland that does electroplating, and it's this one. So number 4, this is clearly not the issue. But we did find 2 stained glass manufacturers right in the middle of these 2 hotspots, neither of which had a permit to emit cadmium. One didn't have an air quality permit of any type whatsoever. And so we're like, okay, this is a little concerning. So we thought, well, let's look at some other heavy metals that we know are associated with glass manufacturing in the moss. So these are just sort of simple interpolated maps, a little small, but the upper one is arsenic. You can see a number of hotspots around the city. Obviously, arsenic, there's some health concerns there. But the biggest one is right over that southernmost of the 2 glass factories, which is ironically called bullseye glass. That was commented on more than once. So it's there. The Ouroboros glass, which is the other one, actually had stopped using arsenic about 20 years before. So they didn't see any there. And the lower panel is selenium. Selenium is not particularly problematic from a public health point of view, unless you're in very high doses. But its primary industrial use is stained glass manufacturing. So we saw mostly we couldn't see anything in the samples. It was undetected, except right over bullseye glass. So we go, okay, well, we're onto something here, maybe. But we want to tread carefully, so we decided to go back and take an additional 25 samples from around bullseye glass. And so what we found here, this is, again, just a simple interpolated map. There's cadmium with bullseye glass right in the middle. And the one on the top is arsenic, bullseye glass right in the middle. The one on the bottom is selenium, bullseye glass right in the middle. So at this point, we feel pretty confident to go to DEQ and say, look, we've got an issue here. And they kind of and and then in October of 2015, they put a instrumental air quality meter about 120 meters away. And they monitored for a month. And this graph is what they found. So this is cadmium, and this is arsenic. Now, in Oregon, we have what's called ambient benchmarks, where these are the sort of limits that we like. They don't necessarily have any regulatory teeth, but they are the sort of targets for a whole range of pollutants. And I've put on the lines there for arsenic and cadmium. They're a little difficult to see because they're essentially along the x-axis. What we found is that the average cadmium for the month was 49 times the ambient benchmark, and arsenic was 159 times. That's not percent, it's not percent, that's times. So that was concerning. Also in the US, there's the Agency for Toxic Substance and Disease Registry, sets called safe minimum levels, both acute and more chronic exposure, not for arsenic. But for cadmium, they have a safe minimum level for 1 to 14-day exposure. So this is a pretty short-term exposure of 30 nanograms per cubic meter. And the average for the month was 29.4, so it was almost violating that on average. For certain days, for example, October the 10th, there was 195 nanograms per cubic meter. So you have levels of cadmium that may present an immediate and short-term public health risk. And this had been here business had been here for 42 years. It's 750 meters from 2 schools and 300 meters from a daycare. The daycare ultimately had to dig up all its soil and burn it as a consequence of this. So we released these results in February of 2016, and within hours there's public outcry. Within a couple of days there was large public demonstrations. Within a week, both glass manufacturers had voluntarily stopped using arsenic, cadmium, and chromium. They also use hexavalent chromium, nice, for green, lead, basically anything nasty and toxic they use in the glass. And they had left the monitor in place, so what we found is the levels here dropped by 99%. So any lingering doubt that this was the source was dissipated. The head of DEQ, about 2 weeks into this, resigned. The governor got involved, had the first cease and desist order against Bullseye Glass in the state's history. The federal EPA got involved, and they had largely given exemption to the art glass industry. That there's regulations that apply to the larger glass industry, but they said, oh, the art glass industry doesn't need to abide by them for some very odd reasons. They then came up and said, well, no, we misinterpreted our own rules, which was never entirely clear to me how one goes about misinterpreting their own rules, but I felt it was churlish to inquire at this point. So the things were fraught enough. So we're going to see the art glass industry will now face much stricter regulation in the US. And because of this is a political disaster for about 2 months, very, very stressful personally. And the whole state now is redoing how they do air quality regulation. It used to be a technology-based system, so if you were a given industry, you had to do X, Y, Z, and that was fine. But now they're moving to a health-based system where you have to actually be below certain standards. It doesn't matter what you do, but your emissions have to be below certain levels. So it was a very interesting experience, and it's showing how in this case, how this cost $20,000, this study, and for $20,000, a little tiny simple plant caused an abnormal amount of chaos. It also shows how what you can do here is use the natural environment is not as a replacement for traditional instrumental monitoring, but as a complement. Because remember here, you can't identify absolute levels. You can just say it's higher here and lower. So we identified these areas. You stick one of the few monitors there, and you can do this. And you can do it relatively cheaply. So hopefully, I've given you some sense then of some of my work related to the natural environment. That both direct exposure to the natural environment may be beneficial to our health, but also that the natural environment may reveal information that helps us identify public health risks. So I really appreciate your time. It's very kind of you to come. Thank you.
I think we all know a lot more about trees than we did half an hour ago. We've got time for questions. I have to ask you, please wait for the microphone to come to you, because we do have people at a distance on the here. And Christina will let you know if they have any questions.
Hi, that was a great presentation. I love your laconic sense of humour. It was really interesting. We're interested in lead here because we don't regulate it particularly or implement the regulations because we don't measure it, so we don't have to worry about it. So I was wondering, the other agency that might be interested in this is Occupational Safety and Health. And I wondered if they got involved in the schmozzle that you had.
Yep.
Because it's quite interesting from an urban planning point of view. We have a little lead place just down on the corner here that makes stained glass, and it's considered, a nice part of little sort of inner city bijou stuff going on.
Sounds horribly familiar.
Yes. So I wonder if you could talk about the occupational safety and health for these guys who are at Bullseye, and also what you think it means for mixed urban development.
Well, those are all good questions. One quick thing specifically about lead is we found some small little lead hotspots around the city. We did some investigation, and what we think they were is house demolitions. That we found these hotspots, and there'd been a house demolished nearby. There's a lot of them in Portland, a lot of redevelopment, and this is leaded paint getting up into the atmosphere. So, and there's virtually no regulations when you demolish a house. Just knock it down, and that's fine. But yeah, I would have loved to see. I mean, the county health authority got involved. The Oregon health authority got involved. This was a huge deal, and they did some looks at some cancer clusters. In my view, in a somewhat rudimentary way, they did find a bladder cancer cluster around one of these, which we associate with arsenic. But it would be very interesting to see the occupational exposure of the people working there. Interestingly, the only filter they had, bullseye glass, was the internal one. They had a filter internally for people breathing that. But clearly, if you've worked there for years, there's going to be a real problem potentially. They have a little house opposite where they have artists can stay because and they have a fig tree. And what I found, somebody told me, said, yeah, they told the people, say they don't eat figs. And so they claimed in this that they didn't know what was going on. But if you've been using heavy metals for 40 years without any filtration, it's a problem. So anyway. Oh, sorry. That's a very interesting point, because what this started as a home business. So it's not in a traditional industrial area. So you have people living directly next to this factory. So that's the type of thing that's in Portland. We have strict growth boundaries. We're trying to encourage, dense development. But these are a problem. If you're going to do that, the very least you need to do is to have better monitoring. And that's what this comes down to. If you don't monitor, all environmental regulations are moot. So you really need to monitor to know what's there, to find these little things, because some of these small businesses, pollution goes far, but if people, as you say, are living right next to them, you could have some pretty intense health effects, in those first few blocks. So I think that's a very tricky thing. It's definitely, there's some tension there between the desire to have dense development and then the consequences of being next to some of these businesses.
Hello, thank you for a delightful piece of environmental health. New Zealand has, this is a comment rather than a question, New Zealand has a slightly parallel problem, and particularly Wellington, in that wintertime people will persist in burning in their wood fires offcuts of treated timber.
Oh,
and I don't think we make enough publicity about not doing it, because they're treated with copper chrome arsenate.
Yeah. You should not burn treated wood, absolutely not, and particularly if it's CCA, which is the old stuff that you don't want to have arsenic. I mean, you can get all sorts of problems with that stuff. It can also, I've seen the little labels from treated timber in mulch on kids' playgrounds. They grind them up and put them under kids' swings.
Yes, I think you get the copper and chrome in the mulch or ash where that's been deposited and the arsenate in the air.
It depends what you do to. Yeah, and then there's also the chromium. You can be exposed to things and can be oxidized to hexavalent chromium. So you should definitely be careful with that stuff.
We need a much stronger public health message about that.
Yes, no, that's stuff you do not want to burn. Yeah.
Thank you very much for showing us more about trees. Going back to your first study, the implication there is that trees per se are an advantage. Can you comment on, is it for instance, the total leaf area? Is it for instance, are hedges as good as trees? I mean, do you know the sorts of ways to quantify the active ingredient in that sense?
No, that's a really, really good question, and one I'm trying to get into. And some of this has been driven. Now, in this case, I wasn't measuring the trees directly. I was just using the EAB as a proxy for loss. But in other ones, I have tried to measured the trees. And so there's been limiting factors by using two-dimensional imagery. So there you're just looking at, say, crown area from above. Now, clearly, do 5 little trees with the same crown area as one big tree have the same effect? I would think not. So now, with the advent of more LiDAR and 3-dimensional imagery, you can start to get the crown volume. My sense is that, having been in neighborhoods where you have large trees, really iconic large trees that can anchor a neighborhood, I think that it's not just you need 10,000 leaves and you can stick them in little pieces or big pieces. I don't think it's that at all. And that's going to be a very interesting question, is to how do we provide that dose, as you say, and how much is required? At what point is this diminishing? So that's definitely something I'm trying to look into, and I think it's going to get driven by advances in remote sensing, largely.
Okay. So hopefully a small follow-up question. Do you know of anywhere, I know there's sort of rules about not chopping trees down sometimes, but do you know anywhere, any urban area that has any sort of regulation about minimum tree populations?
Some places will have new developments. You have to have a tree per house or out in front.
Yeah.
But in terms of sort of neighborhood level, you need to have 25% canopy cover. There are, I know, planning targets. For example, in Portland, we have a target of 33% canopy cover. We're at about 27. But it's an aspirational goal. It has no statutory teeth. I'm not aware of anywhere where they would say directly, here's the number you need to retain or plant because specifically of that number. So,
thank you.
None at all.
Thanks for a fabulous talk.
Thank you.
It was really inspirational. I'm interested in your second study. You've obviously mined the heavy metal aspect really well. Did you measure any other pollutants as well as part of the results of that? We did,
polycyclic aromatic hydrocarbons. So that was interesting. We did actually find that trees could absorb them. And what was interesting there as well, we found obviously the impact of road density, which is the major source there. But what we found is that it was actually more important to have tree canopy. The trees could actually cancel that out. So in terms of, I like to think of trees as part of our urban public health infrastructure. And so the idea, if you're planting trees along major roads to block air pollution coming in. So yeah, we looked at PAHs. That cost a little more. The testing there was about $250 a sample. And it's just, and testing for pH is also a little more problematic from an instrumental point of view because you need active monitors. But there's a whole of other sort of things you can do. I mean, we had other stuff like nitrogen, sulfur, just overall things. But yeah, those are the two we looked at. So like benzopyrene, pyrene, naphthalene, stuff like that.
Yeah, thanks for my name's Michael Baker, I work here. Thanks for a really fascinating presentation. Just wondering about your views on the overall regulation of environmental health in the US at present and where things are going. We had a speaker from Flint, Michigan here earlier in the year talking about the lead contamination of their water distribution system. Obviously, you're from a community which is considered probably relatively affluent, is it, Portland?
Yes. Yep.
And so it's not just the resources, I guess, available at a state level that affect the risks for local population, but do you have any views on questions around environmental justice and the current state of environmental health and monitoring and so on in the US?
Yeah, and I think one of the problems, as you say, Portland is affluent, white communities, prides itself on environmental awareness. This was very hard on people. It affected their sense of self in the city that they lived in. For a while, there was a ban on eating vegetables within a half a mile of that. And in Portland, that was like, ban on breathing. It was a big deal. And I think I would go back to this, whatever one's political views or views on how a particular regulation, I think one could agree that you need to know what's there. So I think without monitoring, how can that be a problem? Let's find out what's there and make informed choices. So I would say that the state of environmental monitoring is there's a possibility for improvement, as in most countries, and I think that's where I would start. Because also you monitor more carefully, you start to see what's there. That will then hopefully inform the policies. I mean, some of these decisions are being made in a void. And so I would, yes, I think that's the thing that keeps me awake at night is what we just don't know what's there.
And just, sorry, a second question. This technology using biological media for sampling, like lichen and moss and so on, is that going to become more common? Because obviously it opens up really fascinating possibilities for how the public could get more involved in sampling in their local environments. Is this a general trend, do you think?
Yeah, and I think this has spurred some stuff. And in fact, there's one in Seattle doing exactly a citizen science project, doing exactly that, where they're trying to get people to bring in samples. Yeah, I think it's absolutely, it will depend on the climate, because, you know, this is in a damp climate like the Northwest and Moscow as well. If you get into drier climates, we did some work in Cincinnati, there you have to use smaller, you know, lichens. You can do it with less biomass, but it just is a little more expensive, so the type of instruments you have to use. So it was an ideal place to do it, but it certainly could be done elsewhere, and there could be other media, as I say, not limited to this. So yes, I think it's very applicable.
It's not a question, just a comment, which is linked to Mary's comment just now. I went to Malaysia, the Ipoh, which is a cuisine center, and they have the Old Town white coffee, which is very famous for years. And there is the called Anton Factory, has been in doing the coffee roasters for over a century, and they are using the treated timber. And I have to say that the coffee tastes much nicer with the arsenic flavor.
Choices.
I have a question.
Yeah.
I'll just use your mic. So my question is about deciduous versus evergreen trees. Any comment about that? Most of our native trees in New Zealand, I think, are evergreens.
Yeah, that's also an excellent question, and that runs into particularly in benefits outside of public health. For example, when you look at stormwater management, very much matters whether it's on or off. But yeah, it goes to the question as well as, you know, are we just looking at generic leaf area? No, probably not. So, and you know, does a tree that has leaf on versus leaf off have the same impact? You wouldn't think so. So I think it goes into the larger thing of what is the optimal type and amount and sort of distribution of urban nature, and the type of trees as species would be one important determinant of that, absolutely.
Is there someone who has this part? Very quick one, and then I'll pass to Mary. We're obsessed in this room with climate change and how to mitigate it and representations of it. And it strikes me, you know, there's been some use made of there's some notification that the Canadian forest that's disappearing as a result of climate change. And I wondered if you could talk about the immediate effects, the health ones that you've identified, but there's this broader environmental catastrophe for which death of trees is pretty central, I would have thought.
Yeah, well, one public health issue that comes to mind is wildfire. I've done some work with wildfire smoke in Southern California, and clearly there's strong evidence now that wildfire seasons are becoming longer and more severe. So that's a public health risk there. And then also there's problems with disease and tree death now with pine beetles in the western US, because you get, particularly say the Northern Rockies, you get some beetles there. If it gets to 40 below, they get really hurt and basically wiped out. And so that there's a way of moderating this. And now the number of winters where that happens is going down. So hey, great, you know. So that it's definitely having an impact there. So how that plays out, and then, you know, how species themselves are shifting in space. You know, we're already seeing that where species are shifting north. Yeah, it's going to be a complicated question, but yeah, I think the fire one is the one that I have the most intimate knowledge of, and that's, you now have parts in the Northwest where, you know, towns that depend on tourism, they get smoked in for a month. Nobody will go, you know, and that's happening more and more. I mean, you look at wildfire suppression expenditures with the US Forest Service, it's exponential. It's a big deal.
Friends, I think we've come. One very quick question, Mary. Last question.
Okay, it was more a comment in relation to your question about trees shedding leaves. I think trees you've shown to be a very good way of picking up what's in the air. I think the trees might be helping these contaminants on their pathways, given that us as animals get rid of waste stuff by urination and defecation. Trees get rid of it by storing it in their leaves and then dropping it, or catching it on the leaves and then dropping it.
Yep.
So you're getting stuff into the waterways anyway. But I think the difference between deciduous trees and evergreen trees is that the deciduous trees drop all their leaves in one go, and they degrade the chlorophylls so that they go the beautiful yellow, red, and then disappear, while the evergreen trees drop their leaves all through the year, and they don't have that yellow-brown phase. And anyone like us who has native trees on their driveway will know they're always sweeping them up.
Right, I think it's just fine. Thanks.
We'll come to an end, friends. Before I invite you to thank Geoff, I would just like to say, because you were the room that is in our department, we have a fine postgraduate program, and you can hear about it as you leave the room. But someone to talk to you. So please join me in thanking Geoff for a fascinating talk.
People are not engaged in our work.
Well, I think
This might happen.